Good morning, guys. This is Dr. Welsh from Indianapolis Sport and Spine, and today I just want to take a couple minutes with you and go over a condition that's very common in our practice and with a lot of people that live an active lifestyle, whether it's runners, football players, volleyball. A lot of people, a lot of different activities can result in a condition called plantar fasciitis. And what plantar fasciitis displays or presents itself as is heel pain, basically. Okay, so heel pain, it's going to be more prevalent in the morning time when you first get out of bed. This is one of those things, if you stay off of it for a while, you probably notice it gets a little better, and then by the time you get out of bed or you go to stand up when you're at the office or just sitting for a while, you go to stand up and the pain becomes very intense very quickly. And today I want to kind of clear up some confusion about what plantar fasciitis actually is, what causes it, and ways to not only treat it but prevent it in the long term. Okay? A couple more popular ways to treat plantar fasciitis that many people are aware of involve rolling the arch of the foot with either a golf ball or a frozen bottle of water. Another one is going to be a cock-up splint that can be worn on the foot at nighttime to keep your ankle in dorsiflexion or keep it toed up. That'll help stretch that heel out. And while these both can offer some limited relief and help the problem in the short term, long term it rarely will give you a good prognosis because you're not addressing the underlying cause or what's actually getting to that heel pain. Now, in our office, what I usually will address with patients is addressing first and foremost the ankle flexibility as well as the calf muscle flexibility and what kind of tension and adhesions they have developed in that calf muscle. So when we're dealing with anything extremity, spinal, or otherwise, the big thing to understand is that you can't just follow the pain. Just because the heel hurts doesn't mean that the heel or the ankle is where the pain is coming from. In fact, many times in my office with patients that we're treating for this condition, we will track it all the way into the hip and the lower back, and it gets all involved with gait mechanics and what the whole foot and leg is going through. So rolling out the foot, pulling up on the toe, yes, that can give you some relief, but unless you're figuring out what is actually leading to that tension, you're just going to keep re-injuring or having flare-ups down the road. So we want to address not only ankle flexibility, calf muscle flexibility and mobility, but we also want to address the hip extension. Okay, and if you take a walk, as you're walking through, I want you to pay attention. As your leg or as your foot trails behind you, the further back your hip extends, the more flexion your ankle is going to see. Okay, so if you're a long-distance runner, an endurance athlete, or somebody that even wears high-lift shoes, high heels for the women, what you're noticing is it puts your foot in a more pronounced plantar flexion or toed down position. And what that does is it actually shortens your calf muscle. Okay, so then when I bring my foot out of that position, if I try to stretch it out, if I try to get that mobility back, it takes some time for the muscles to readjust to that normal gait mechanic because your body does adapt. Okay, if I spend all my day shortening my gait up, wearing dress shoes with a heel in them that can lift my heel up a half an inch or more sometimes, that's going to give my body a chance to adapt to that position. And what will happen over time as that calf muscle shortens, it starts to tense up. It puts more pressure on the Achilles tendon, which turns into the plantar fascia as it wraps around the heel and goes through the plantar surface of the foot. Okay, so to recap, a couple of things we want to look at. We want to address the ankle mechanics. We want to get the ankle moving, getting quite a bit more ankle dorsiflexion. We want to loosen up or break down any adhesions that may be present in that Achilles tendon area or up through the calf muscle. As you look further up the chain, you want to ensure that you're getting good hip mechanics, that you're getting good hip extension, and that your lower back is freed up and moving properly. Okay, so There's a lot of things you can do on your own to help prevent this. I know, rolling a tennis ball is pretty popular. Getting a foam roll, you can address all these things pretty easily as long as they're not long-standing or chronic. And if they aren't responding to this kind of treatment or this kind of maintenance on your own, feel free to give us a call or shoot me an email or contact me through Facebook and ask questions. That's what this is here for, to help educate you, to give you the most tools, the most options for taking care of your body and keeping yourself in top shape, top health that you possibly can. So again, my name is Dr. Welsh with Indy Sport and Spine, and we'll talk to you later.